Good evening. I am ready to start whenever it is. I think if two more people will join, then we can start the session. Shall we start the session?
Yes, sir.
Okay. So, like, I asked for somebody to volunteer for the active candidate. So, is the active candidate already selected, or I shall select from the three people who have joined?
So this will be the interactive session for all.
No, I specifically told that it cannot be interactive session for all the candidates. It will be like one person I shall select then who will be discussing the case with me at the end of the session. Like it will be
Yes,
10
sir.
minutes only.
You can do that.
The other two people can ask the questions if they want to. Okay. So I shall be discuss. So hello, I'm Dr. Sangshaptak Saha. So today's session is the first class on communications. Communications in the new format is like it will be two cases, station 1 and station 4. So today we shall be mostly doing the station 2 cases. One will be, so there are three candidates. So I shall be selecting one person who will be doing the case actively with me, and the other two persons can ask me some questions at the end of the that part. And after that, there will be another second case where another candidate will be doing, and the other two people can ask me the question after that. So I shall share my screen, and I think Dr. Rejoy Bandyopadhyay, he will be the first candidate for active candidate for the first case. Is that okay, Dr. Rejoy?
Yes, sir.
Yeah, fine. So you will be doing the case actively, and I shall once I share the screen, you will have 5 minutes to read the case. After that, you shall I mean, it will be like an mock exam only. So you shall be doing it 10 minutes. Just allow me to share the screen. I think my screen is visible.
Yes, sir.
Yeah. So 5 minutes.
So everyone has joined.
Dr. Rejoy, your 5 minutes are up. I think we can begin the session. Dr. Rejoy? Hello, can you hear me? Dr. Rejoy, can you hear me?
Yeah, good evening, Dr. Sangshaptak sir.
Good evening.
Yeah, on of the side, sir. Actually, Dr. Vijay Bandyopadhyay is probably in the traveling, so that's why you can't join in this meeting. So you can go with the others candidate. There is a Dr. Shobik Pandey is there.
Okay,
Dr.
so whoever you can, I think everybody has seen the screen. So whoever can do the session can just unmute themselves and tell me,
Yeah.
and I start the session.
Yeah. Dr. Shobik Panja sir and Dr. Tanmoy, if you want to join this session, so please unmute your mic and please join this session.
Dr. Shovik, if you are available, then unmute yourself and we shall do the session. Because in the communication session, it needs to be one person who will interact with me directly. Otherwise, communication session cannot be taught. I mean, I can teach it. I can do the role play and everything. Dr. Tanmay, I showed the scenario for 5 minutes, but yeah, you can see it again. In the exam, you will get 5 minutes. They will not allow you a second more. Once you are ready, you can unmute and tell me.
Yes, sir. Dr. Tanmoy is wrote something in chat box. Can you please show the scenario? Okay, I think the doctor is interacted with you.
Sir, I'm ready.
Okay, so we shall start. Doctor, like you know how the scenarios go usually, right? You have practiced.
Yes, sir.
Yeah, fine, excellent. So you can just start. Okay, you have
Okay,
entered the room and you can start. Yeah.
Okay, sir. Um, Good evening. I'm Dr. Tanmayi. I'm the doctor in the clinic today. Are you
Good evening.
Mrs. Ann Bath, the 43-year-old?
Yeah, I am.
Yeah, it's nice to meet you. I'm here to discuss about your health condition. Is it okay with you?
Yeah, it's fine.
Do you have any idea about your health issues?
Yes, doctor. Actually, I am having some pain in my tummy for the
Yes.
last. It previously also it was there, but the last few weeks or like last month, it has been a bit more than usual.
Okay. Is that it? Is there anything else you want to add? Are you taking any medication for that?
I am taking some medications. I also have passed a loose stool for a few times. So I am taking some over-the-counter medicines for that. Besides, I'm having this problem for a few times previously also. So I
Okay.
know which medicines to take. So I have taken those medicines, but I have not got much of a relief this time.
Okay. So I'll explain your condition. So you are suffering from something called celiac disease. So which means your intestines, your small intestines, are not able to digest gluten properly. Gluten is a substance, a protein which is found in mostly wheat. So whenever you're having wheat or any substances which contain wheat, for example, bread and pasta, you will develop something called soreness of your intestine. So these substances react badly and cause all these symptoms. For example, you will be having tummy pain, you will be having diarrhea and abdominal discomfort. Are you getting me?
Uh, uh, Doctor, what you were telling is that I have some disease and
Yeah.
all my features are because of that.
Yes,
And
it is called
because of
celiac
something
disease.
and it's because of something I'm eating, right?
Yes.
Okay. So, like, what is the disease about?
So your defense system is reacting abnormally to the your food in the digestive tract, in the small intestine. So whenever you are eating this gluten containing foods, for example, bread and pasta, you are developing these symptoms. So along with that, you are also having anemia and low blood levels, which can be corrected easily with iron and folic acid supplementation.
Yeah,
But
so I'm already taking.
yeah, okay, I understand that, and that's a good decision on your part. But you also need to do something called gluten-free diet.
What is gluten, doctor?
Gluten is a protein contained in wheat. So there are many foods which are available, for example, rice, barley, which you can eat, and these are completely fine. They won't react with your intestine, they won't cause any abdominal, any tummy pain or diarrhea. So this is one of the most preferred modality for your condition. Are you
Okay.
getting it?
Yeah.
So if you can adopt this
like
diet, that will cause like relief of your symptoms.
Okay, doctor. Like I love taking this wheat, this bread. It's a part of my diet. I mean, I in the breakfast I take some of those. I take some crackers, and in the night I usually take bread. So you're
I
telling me that
understand.
I need to avoid those?
Yes, I understand it very difficult for you, but if you can do this, unfortunately, this is the only treatment available.
So is it only the so I only need to avoid this bread, like this rotis,
Yes.
and everything else I can eat.
Yeah, you also need to avoid some barley and rye containing foods also.
I don't eat barley or rye anyway.
Okay, that's good. You can eat rice, you can eat oats to some extent. So I would suggest you to go for these foods. And
Okay.
all fruits, vegetables you can eat. You can eat meat. You can eat eggs. I'm sure you can, if you try, you will be able to manage with these foods.
Okay, doctor. Okay. So, doctor, I'm already taking these pills. You are telling something about iron, that I have
Yes.
less iron in the body. So I'm already taking that.
Yes.
And I saw, and I went to a GP last week. He told that my iron levels are improving.
Okay. So if you have completed 3 months of this iron tablets, we will check the hemoglobin again in your blood.
Yeah,
If that
because
is normal,
I have, yeah, okay.
if that is normal, we can safely stop these tablets. Are you having
Okay.
any other problems?
Actually, you see, after taking this iron, etc., though I'm maybe because my blood levels have gone up, so I'm feeling much better.
Okay, that's good to
So,
hear.
do I still need to modify my diet?
Yes, you still need to modify your diet because the only treatment available is gluten-free diet, unfortunately, and that works very well in your condition.
Okay, so I can take
We can
rice.
provide you a dietitian referral. We can provide you a nursing care so that they will help you with your diet. They can make a diet plan and help you with the nutrition level.
Why do I need a nursing care, doctor?
Dietitian, sorry.
Dietitian. Okay. So this because you see my one of my cousins, she has
Yes.
this disease strange name celiac disease, I have told her, and she eats some food products which she tells that it's she cannot tolerate that food product itself, and she tells that the loose stool was better than this gluten-free diet that you were telling. So
Okay.
will I be able to tolerate it? Because I love eating food. There are people who love eating food and enjoy their meals. I am one of them. So
Yes.
yeah, how will it go ahead?
Yes, I know it's difficult, but first you have to try, and you'll only see the improvement in symptoms. And maybe you will start liking a few foods also, which you can try new, which you have never tried before.
Like rice, right?
Excuse me?
Like rice.
Yeah, yes.
Okay. Okay. How sure are you that this disease is what you are talking about? And I mean, it can be simple case of like some bugs in my gut which is causing this diarrhea also, right? These loose stools.
Yes, but you have been evaluated thoroughly, and you have also been they have also conducted an endoscopy test, which they pass a tube inside your stomach and take a small bit of a tissue, which was taken from your intestine. So that tissue was examined in the lab, and it showed strong evidence of celiac disease.
Yeah, they did a pipe test, camera test, which
Yes.
yeah, okay.
So
Okay.
this diagnosis, we have good confirmation, and we think this is right. There is no doubt about it.
Okay. So I only need to stop eating the this wheat containing food, this
Yes.
gluten, and
Yes.
which is only present in the wheat and some other food product like rye and barley. Which
Rye and barley.
don't eat, and I need to take rice, right?
Yes, exactly.
And I need to go and see a dietitian.
Yes. Do you have any other concerns?
No, doctor, I'm okay.
Okay.
You have 3 minutes left. When in an exam, whenever you have 3 minutes left in communications, you have to realize that you are missing something. Otherwise, there will be
Yeah.
no time left.
Yeah. Um, I can ask about smoking and driving, but right now it's not relevant.
What else?
Occupation.
Occupation is already mentioned. She is a librarian.
Yeah. Is it affecting her job in any way?
She needs to go to the washroom multiple times. That's it. Otherwise, it's okay.
So that will improve on changing the diet.
Yeah. So if you ask that and if you tell her that, then it will be more easier for you to convince her about the taking the diet. Okay.
Yeah.
So that is one point. Second point is you did not ask about alcohol.
Okay.
She is a beer lover. She takes
Okay.
beer, scoops of beer every day. Beer
Okay.
contains gluten.
Huh.
And if you had asked and if you had told that she can't take beer, she would have become extremely anxious and told that it is not possible for her. That was the main point of the scenario.
Okay.
Do not forget asking about the. I mean, I'm not telling that was the main point. I'm just telling it so that you remember. Okay, that would have consumed at least 1.5 minutes of your time.
Huh.
She's a 43-year-old librarian. If you would have told that yes, I end the library at 6 p.m., then I go and. Hello, sorry for the interruption. Till when did you guys hear me? Can you just tell? I shall restart from there.
Yes, sir, we can hear you.
Yeah, I know. I mean, till which part did you listen previously? I can restart from there.
Like nothing, sir, actually.